We're calling to order the Social Service Committee meeting for September the 27th. The first order, of course, is to approve the previous meeting minutes. The motion's made.
Second.
And the, can't even remember your name, you did something wrong. The second, all in favor?
Aye.
My ice cream man. All in favor? Aye. Any opposition here? None, it's unanimous.
Can I make a comment?
Yes, sir.
If I may, on the minutes. I know we get an email to us, but
Yes.
I wasn't able to access the website and, you know, so I'm really, we used to get the minutes sent directly to us on email. And I would like that to be
A
done
request for
again.
your email.
Instead of us having to go and navigate the Albany County website, which is a pain in the neck, quite frankly. So, you know, if we could get the agenda sent to us ahead of time for
Email
social
it,
services.
you.
Yeah, that's what we used to do, right?
Okay.
Yep.
Okay.
Has there anything changed in the, on the IT side of things? I don't know if anyone.
Yeah, well, there's an issue going on, sorry.
Yeah, other people having problems.
Yeah, everyone seems to be, ourselves included, so we're
Okay.
currently trying to
service
deal
providers
with
that
it.
contacted.
Yeah, so we hope to have it back to the way it was, if not better.
Excellent.
Yeah, right.
Dodging.
It could be anybody. Yeah, it could be anybody.
400-pound guy did it.
The moral of the story is we're working on it.
So it's settled that the office will send copies
We'll,
out
we'll
of the
look
next
into
meeting
it.
and see if it's all.
Yeah, we'll see if that makes sense
Thanks
as
a
far
lot,
as.
Mr. Bullock, for that request.
I didn't think that was gonna come up first.
Okay. Good evening, Michelle McClay. She's back from vacation. She's ready to work hard, and I'm glad she's here with us. Okay, the first order of business is authorizing an agreement with the Equinox Inc. Regarding non-residential domestic violence services. Michelle.
Thank you. Good evening, Ms. Chairwoman and committee. This request is for the non-residential domestic violence services, which are basically the community-based kinds of services for treating and handling domestic violence issues, including a 24-hour hotline, information referral, advocacy, kind of all those soft community outreach services. It also provides some intensive case management to people to assess them for actual domestic violence, to make a plan for them, and to make referrals to the shelter, which is coming up next, or other resources in the community. And this is 100% federal funded service.
Thank you. Any questions, concerns? Yes.
I had a question. Should we be concerned with awarding another contract to Equinox since they just pulled out of a contract with us in the last couple of weeks?
So, are you referring to the youth shelter?
Yes.
So the county actually didn't have a contract with them, but that makes it no less concerning. Then Maura may be able to elaborate even more than I. This is the Deputy Commissioner of DCYF. That particular program within Equinox was more related to DCYF. The only time we utilized that resource directly was on occasion we placed individuals there, sometimes as a stopgap to foster care and paid a per diem, correct, Maura?
Correct, and otherwise it was the emergency group shelter for youth.
Right, so it was actually more of a community resource, which to a certain degree means it's just as concerning, if not more so. Equinox is very effective in these programs, and in my humble opinion, I would suggest that due to their effective service provision in this area, we continue, but at the same time, be cognizant that the county is now, even though it hadn't been before, at the center of this conversation. It's my understanding that the state of New York has engaged with Equinox due to the limited notification they gave before closing down. It is also my understanding they're meeting with them this week. We may know by the beginning, or excuse me, by the middle of this week, as in tomorrow or Thursday, what the outcome of that is. All that aside, my office and the Department of Children and Families is also engaging with all of the service providers in the community, specifically through CARES, to try and figure out an alternative location, if one may be necessary, to try and get another youth shelter up and running. There is some funding available in the community because the county has this resource and we want to preserve that. There is also a system set up so that if Equinox does indeed close its doors at the end of the month, that there will be resources for the placement of youth. It's unfortunate to say that they will not be within this county. They will be in Schenectady and in Malta. But if individuals are placed in those locations, they are still able to receive resources to transport them back here for things such as education and things like that. So it is not ideal, but there is a whole lot of conversations going on. And I hope by next month, we'll know exactly what's going to happen with Equinox and the youth shelter specifically. And two, I'll have something to report to you related to the possibility of an alternative location. But that's the best I can give
Creating a
you.
regional model maybe?
Yeah, I mean,
Just have the
fortunately,
city
our
hall.
conversations with Safe Incorporated in Schenectady and Captain in Malta have been very good. They're more than welcome to take. But the reality is that the population center is here and the need is here, so we need to have something in the community.
And you have a follow-up for yours, then I got you, Bert.
And if I just may add
Yeah.
that also, we have used both of those facilities in the past. A lot of times the juveniles are involved in gang activity or other issues such as domestic violence, and we need to move them into a safe location. So we have had a working relationship and collaboration with Safe Inc. and Captain.
And Ms. Touche, you want to follow up on what?
So in other words, there's no concern that Equinox won't be able to perform this
Correct.
this service?
Correct.
Okay. Thank you.
Mr. Bird,
My question is sort of along the same lines. When they pulled out of the contract for the Division for Youth,
So there was no contract,
There
they
was no
just,
contract?
there was no contract with the county, correct?
Yes, my understanding is there's not, they are actually through OCFS, they're certified as a
Okay.
program that they can be utilized, but it's also the housing, the OTDA, that pays for the children that come in and stay there in an emergency because technically they are homeless.
I guess what I was asking was, under that arrangement, is there some requirement that they give us a time notice under that arrangement?
So, yes.
And
Yeah.
are they within the time notice of pulling out of that arrangement?
My understanding is that not necessarily they give us a time notice, but the state. It is also my understanding that the money used to bring that location up to youth shelter standards was state funding, which in itself also has strings attached. So that's these meetings, we're not getting a lot of information from the state. So this is, I don't want to get too far down the rabbit hole of what is rumor and what isn't. But it's my understanding that the state was not too happy when it heard about the 2 months' notice for, it was 13 beds at max,
Right, and they went down to 8.
and then they went down to 8 and 6. So
Well,
they,
I guess my point is, going back to these contracts, and we never see the contract, nor should we see the contract, but are we convinced that the Department of Law, in negotiating these contracts and social services, are gonna have a time frame in it so this cannot happen to us for these type of services, especially with an organization, for whatever reason, maybe bouncing in and out of various levels of service?
all our contracts have provisions in them requiring a certain amount of notice that we deem to be appropriate.
And you
for
feel
this.
that
Yes.
your standard criteria, given this situation, is sufficient?
Yeah, honestly, the real reason this situation is so problematic is because those measures weren't necessarily in place from a formal contractual perspective. It was a community resource.
Okay. Ms. Lockhart.
I had heard about this through the rumor, but why were they getting out of it? What was the problem, do you know? Why are they closing?
It was represented to me and the county executive that the funding was not adequate to cover expenses, and therefore they were siphoning funding from other programs, which was causing those programs to suffer. I can not speak to the validity of that.
Yeah.
If you heard earlier, the deputy commissioner referenced that the facility was actually open for 13 beds, and then they lowered it to 6, and they capped themselves at 6 or 8. But either way, they began capping themselves and not accepting more, even though they had the capacity for it. And there had been some grumblings related to some of the individuals being sent to them being high needs and them not being able to handle those individuals, which given the populations that we serve, I think we all agree isn't necessarily a valid way of going about providing service, but it is
But that's a
nonetheless.
big hole, that's a big gap in service
it's
for
huge,
Albany
it's
County.
huge.
It's huge.
And next, Mr. Bullock,
Oh, you answered my question.
Oh, okay.
it's all answered. Do I hear a motion? Motion's made, it's approved, all in favor?
Aye.
Any opposition, hearing none, it's approved. Okay, Michelle, number 2, authorizing an agreement with Equinox Inc. regarding the residential domestic violence services.
Yes, we're requesting approval for a renewal of this per diem contract. It's for the domestic violence, the main domestic violence shelter in the county. It is a sole source provider. There's very few of these certified shelters around the state. This is one of them. This is for the next year, a renewal of a contract to provide those per diem payments for domestic violence victims. And the shelter also includes, of course, 3 meals, snacks, and also supportive services and case management to help people transition and move on.
So this is a $600,000 problem?
Yes.
Okay, I hear a motion. Motion and second, all in favor?
Aye.
Any opposition? Hearing none, it's unanimous. Number 3, authorizing agreement with the Catholic Charities Diocese of Albany regarding emergency and transitional shelter services. Michelle.
Yes, thank you. This is a request for actually an update to a contract that was already approved by this body in April. The Catholic Charities Services for the Mercy House and Charles Lawanga Center had made a request to the Office of Temporary and Disability Assistance for an increase in their shelter allowance. It had been since 2009. So they asked for an increase and they received approval to get an increase in reimbursement for up to an additional $88,000 on an $884,000 contract. So we're just asking to amend that contract to a new amount.
Shelter allowance amount, okay?
We'll make a motion.
Motion's made. In the second, all in favor?
Aye.
Any opposition? Hearing none, that's unanimous. And number 4, authorizing an agreement with the community maternity services regarding maternity shelter and support services.
Yes, thank you. This is also another kind of sole source provider service.
Yeah.
This is a shelter, a little bit longer term shelter for girls and young women, 16 to 22, who are pregnant or parenting. And so this is reimbursement for that shelter, which is 100% federally reimbursed. And it provides intensive case management and helping the young women and girls get on their feet, basically.
I hear a motion. Motion's made, and second. And it's been seconded, all in favor?
Aye.
Any opposition? Hearing none, unanimous.
Thank you.
Gail's not here tonight, am I right?
Correct. She's,
Okay.
unfortunately, she's in Syracuse.
Oh, road trip. Okay, the first one, number 5, authorizing agreement with Cornell Cooperative Extension regarding the Youth Bureau program.
Thank you very much, Lady Chairman.
Yes.
And members, the department respectfully requests legislative authorization to enter into a contract with Cornell Cooperative Extension. It's for $4,000 to do the 4-H program during the summer months. They've been operating, this is actually the 44th year, they've been providing this service at Ridgefield Park in the city of Albany. And the target is for youth ages 6 to 13 and adolescents 14 to 18. It's really a summer youth development program, and the funding is provided by the Youth Bureau, which is reimbursed by OCFS.
It's so moved. And it's seconded. All in favor?
Aye.
Any opposition? Hearing none, it's unanimous. Number 6, authorizing agreement with various municipalities regarding youth development programs.
Yes, thank you. We're requesting legislative authorization to enter into 13 contracts of municipalities here in Albany County. This has actually, they provide youth services in each of these municipalities. They have submitted requests, and we have honored all of those municipalities who have put in a request for funding. So it does list out the various allocations and the programs that they would be providing in their communities. And basically, this is a reimbursement directly related to what they have provided in their municipality.
Any questions or concerns? Do I hear motion? Motion's made. Hear second. Seconded, all in favor?
Aye.
Any opposition? Hearing none. Number 7, authorizing agreement with SUNY Albany School of Social Welfare Center for Human Services Research regarding the Juvenile Detention Alternative Initiative.
Yes, this is actually a renewal contract that we're requesting authorization to enter in. And it's with the University at Albany for the amount of $51,038. The JDI initiative is really looking at alternatives for detention, so youth aren't in secure or non-secure detention, as well as we really look at racial and ethnic disparities. So we really don't want children to be sitting in places. We want them in the community, but we want to ensure that they're safely in the community and there's structured activities for them to take part in. SUNY Albany has really been a great asset for us because they've provided us the data that we need to really identify what the challenges are in our community, and then helps us to strategically plan and provide intervention for services. So this would be continuing that contract. She's a part-time employee. The other part of the monies that we receive through the JDI is for our JDI coordinator, who is also part-time.
Any questions? Questions here?
No, I make motion.
Okay, motion's made. Second. Second, all in favor?
Aye.
Any opposition? Hearing none, that's unanimous. Number 8. Okay, authorizing agreement with LaSalle School regarding family assessment intervention services.
Thank you. Yes, LaSalle School has just recently, we had an RFP, a request for proposal, out in July of this year, looking for this service to be provided as a contracted entity. LaSalle proposed and scored high on the evaluation, and therefore we're looking at awarding them the family assessment services. It is a two-pronged program because it really looks at youth that are entering into family court. The judges have all agreed to allowing us the opportunity to meet with the youth, find out what is currently going on, hopefully safety plans so that youth does not need to go into detention. The other piece of it is if the judge and the clinical team decides that there is a need for some type of a placement, that there would also be aftercare services. So as soon as that juvenile is put into a detention facility, they would be working with, the clinical staff would be working with them to decrease the amount of stay in that program and reunify with the family and back into the community to be productive. So we're looking at LaSalle with this contract in the amount of $134,143.
Do I hear a motion? Motion's made. Second. All in favor? Aye. Any opposition? Hearing none, that's unanimous. Number 9, amended the 2016 Department for Children, Youth, and Families budget. Acceptance of additional grant funding regarding emergency and transitional living services for runaway and the homeless youth in Albany County.
Thank you. Yes, we are looking for legislative authorization to accept this money. The money's in the amount of $72,898. This would be RIA, or Runaway and Homeless Youth funding. And basically, the reason for the discrepancy in the actual budget was that we just took on in 2015 the actually, taking the allocations for the municipalities. So we actually monitor and then give the money to the municipalities. Historically, that was something that OCFS did. So we didn't know if that money would continue on an annual basis, but they have kept their word, and we are receiving additional funding, which will help support the Youth Bureau RIA funding.
Any questions or concerns? Do I hear motion? Motion's made and the second's made. All in favor?
Aye.
Any opposition? Hearing none, is unanimous. Okay, number 10, amended the
Thank you.
Y'all hear a question?
No.
Oh, okay. Amending the 2016 Department for Children, Youth, and Families budget, the New York State OMH and OASIS funding.
Thank you. Yes, we're looking at amending the budget. The money has already been accepted into the Department of Mental Health budget for we call it the HIT funding, Health Information Technology. As the mental health system is fastly changing, we're going to need to ensure that we are reporting accurately to our managed care companies so we can receive reimbursement for the services that we provide through our children's mental health clinic. So it's imperative that our information service is up to speed. OMH has provided us with guidance about things that we can purchase that will, again, keep information secure, so there's no breaches of any type of data, in addition to having much more mobile activity, because our staff are going to be in the field, but needing to report into the managed care entities about the client contacts that they've received. So that money will go towards purchasing laptops and securing our, IMA is what we call it, technology system.
Is this technology system similar to the HICME program that we have passed resolutions for in place?
No, it is completely separate. It's a standalone, only the Department of Mental Health and DCYF Children's Mental Health utilize this system. But it's a wonderful system because it can do the automatic billing. But as we're expanding and all of the children will be in a managed care entity, there won't be any straight Medicaid that we need to actually be compatible to your CDPHP, your Blue Cross, whatever the insurance company may be.
Sounds good. Any other questions? Yes, Ms. Jones?
Yeah, so this goes for laptops and essentially some software?
Secure, yes,
Okay.
secure features, especially that they can have access in the field.
And this are all of the county Medicaid caseload, whether it's mental health or otherwise, are they all on an electronic health record system?
I can speak for our department, yes, all of but we have various systems. For example, child welfare is the connection system, mental health is the IMA system, Healthy Families is the NICE system. So every state agency has kind of their own system that they
don't talk to each other?
They don't. I mean, that would be ideal in the future if that is something that technology is able to. However, it's also a challenge due to confidentiality and regulations regarding HIPAA.
Right, but as long as you have firewalls and protections in there. So right now, if you have a kid who's in the mental health system, receiving mental health services, that medical record or that data set is not integrated with the child welfare, foster care, whatever system.
I think we,
Yeah, I
no,
was gonna
no,
say.
yeah, because we had a meeting this morning.
So there is currently we assume will be an ongoing effort. If everyone's heard of the CORE Initiative, the CORE Initiative, a subset of that was a very long and drawn-out process in which the county, specifically the Department of Children, Youth and Families, Children's Mental Health, which is a subset, Department of Probation, and then the city school district and police department, created a legal framework of permissions and firewalls and things like that to not merge data sets, but basically take separate data sets, push them through an algorithm, and that algorithm would match up individuals who are hitting multiple data sets, which would allow us to approach those individuals via the primary contact. For many of the DCYF cases, it will be DCYF or Children's Mental Health, and get a waiver allowing for that discussion to begin. But that's a long answer. The short answer is that's not happening right now. We're hoping to get to that point. And just so you know, this specific program is specific to really the city of Albany, because it was a state program called the CORE Initiative, which was piloted in 2 New York communities, Albany being one of them, and was specific to the 3 core neighborhoods that were the South End, Arbor Hill, and West Hill.
Because ideally, if you have a child in the mental health system, I'm sure that child has a case manager that should be connected to if the child's receiving services elsewhere and another social services division. Those case managers should be able to.
And we do that on a regular basis. We call it family team meetings. So everyone who's involved is working together. Again, that's also driven by family members, so whomever that family wants to participate in those meetings does so. And of course, just historically, we get releases of information. We talk to all providers that are working with that child and family.
And that communication that she's referencing, you know, it's been happening internally to DCYF, but this is really the first venture that we've had in terms of trying to get the universe of individuals that have been involved in a case, whether they're touching the police department, probation, obviously DCYF as mentioned, and getting everybody in the room to try and get intense case management around those individuals, because it's pretty well known that once they hit the criminal justice system, there's a very short period of time you have to intervene before a much more serious interaction happens that in all likelihood is going to adversely affect somebody in the community or the individual themselves.
So are these laptops for the case managers?
Yes.
Who exactly? So
It is
these are-
actually for the case managers. And also what we're looking at as well, people that are outstationed, because the way the future of children's mental health is moving is that we are going to be having health homes. All of our targeted case management will be absorbed under health homes. The eligibility for health homes will expand, so we will be serving more children and hopefully earlier, so they're not at that high level of acuity. In addition, reaching out to schools to really look at, Burn Knox Westerlo, providing a satellite clinic within that school, so that clinician can actually input her notes and treatment plans with the family and have it signed off on and automatically go to whatever insurance that we can then bill for.
Thank you.
So do I hear a motion?
Make a motion.
Motion's made, second. All in favor?
Aye.
Any opposition? Hearing none. And the final one, number 11, amending the 2016 Department for Children, Youth, and Families budget, the administrative adjustments.
Thank you. We're requesting legislative authorization to actually eliminate a line that we had of a part-time special education evaluator, which has been vacant, and then creating a SEA teacher. A SEA teacher really was before a per diem line that we had, and we would pay an individual out of that. But again, it was a challenge to have someone on a per diem rate that would be coming in. So this would be a part-time position that would not only provide SEAT services to children birth to age 5 years old, but also be our going to the CPSC chair meetings and advocate for our children that are identified with some type of developmental or speech or language disability. And that's a core piece that we provide to ensure children are receiving the proper services in each of the school districts.
Any other questions? Concerns? Have none? Is there motion? Motion's made and it's been seconded. All in favor?
Aye.
Any opposition? Hearing none? Unanimous.
Lucy, can I just ask the county exec staff one quick thing?
Can you call them after the meeting? Because the other chairman is right behind us.
It'll take 1 second.
Right after the meeting. Motion to adjourn? Motion to adjourn. All in
Okay, I
favor?
kind of
Aye.
want to say it in front of everyone because I know